Welcome to Arogya Physio Tips. So today I'm going to explain to you about a very familiar topic for our female subscribers, which is none other than DR, but comes with a little twist. DR in men. Yes, you heard it right. DR can happen both in female as well as male, but for female, of course, after postpartum, that is after your pregnancy, but it can happen in also to male category also. How? Because there are various categories that I'm going to explain in detail how DR can affect in men as well. So before starting to various factors, we have to explain about what is DR. So many of the followers who don't know DR is nothing but diastasis recti is nothing but our abdominal muscles, which is getting separated from the linea alba with the connective tissue getting separated, so that the muscle which is attaching all your abdomen into the shape, it gets separated because of the weakness for various reasons. So there are various risk factors, the do's and don'ts that you have to take care of, and then how can you detect a DR, and what are the exercises that you can prevent if you have a DR. So basically, risk factor first, mainly it is in men, it is seen in men with age above 35. So once you are above 35, your age, your collagen in your body decreases, thereby decreasing the strength of the connective tissue. Other risk factor mainly seen in men with DR is because of heavy lifting. So lot of men who doesn't know the exact way to lift heavy weights, such as especially in deadlifts, heavy squats, and other planks, crunches. Those who are doing it repeatedly and without correct form and format, the people are seen with DR. So why exactly is that? Basically, your six pack, which is mainly developed by our rectus abdominis, is not able to comply all our abdominal muscle body weight, so it will get separated and all the other muscle get separated and become a very whole like structure in there. So thereby, instead of only focusing on the rectus abdominis muscle, that is your six pack, we have to focus on the transverse abdominis muscle, which is the whole muscle deep beneath our superficial muscles, which helps in protecting our back, our core, and helps in preventing the DR to pop. So apart from the exercises mentioned below, there are few other exercises also that includes forward bending basically, and anything that is extending your back, and any V-ups, which all will be shown later in the video. How you will check if you have diastasis recti or not? For that, you have to lie on a playing ground. Bed is also like appropriate. So you have to bend both your legs. You have to keep both your fingers on your umbilical, that is your navel position. And then what you have to do, and you have to crunch above. So then you will feel, if you have an abdominal diastasis recti, your finger will go deep, showing results of positive sign of diastasis recti. Going to show you what you shouldn't do and what you should do in order to prevent diastasis recti and to recover from diastasis recti. Mainly, people will think in order to strengthen our core, it's our six pack, that is our rectus abdominis to be strengthened. So for that, many people will start with our normal crunches, which is not at all appropriate, because that will strengthen our rectus abdominis and not the core. Next, whatever activities including our V-ups. So if this is also engaging our six pack muscles, that is the rectus abdominis and not the core to be specific. Next, any activities including roll ups like forward and backward bending, anything with hyper extension of our back, which engages our whole of the abdomen. These are all the do's and don'ts. And our normal planks, our deadlifts, our squats with heavy weights, all to be out. What all are the exercises that we can do to prevent the diastasis recti? That is mainly to help build our core rather than only our six pack muscles. So basically, let's start with the basics. We have to lie down at a plain surface. We have to keep both our hands at the sides of our abdomen, and while inhaling, we have to feel both the arms expanding. So you have to breathe in through the nose and breathe out through the mouth. Next simple exercises in lying down we can do is the bridging. So while bridging, you have to keep the feet apart. You have to lift up your body, and while lifting, you have to breathe in. Next exercises will go for a dead bug, which is you have to keep both our legs up and arms straight. You have to do alternate legs and hand together. You have to go straight. So while going straight, you have to breathe out. So now we are going into the crawling position, which is on our all fours. Here the simple exercises we can start with is our cat and camel, which is you have to make a hump and make an arch over your back. So making an hump, you have to look down and breathe out. In crawling position, we have alternate hand and leg, like what we did as dead bug. So here we have to extend both the arms and legs. While extending, you have to breathe out. Coming to the sitting position, there are a few more exercises that we can do. First, you have to extend your hand up, and then you have to crunch your both legs up. So while doing that, we will do alternate arms and legs crunching. That will be so we are going for standing exercises. So what all you can do in standing? So basically, it's a simple but effective exercises. What you have to do, you have to tilt your pelvis back and forth. So while making an arch, you have to breathe in, and while tucking, you have to breathe out. So one of the other exercises in standing, we can go for side crunches. That is, so guys, till now we have seen the how to detect a DR, how to do exercises, what all not to do if you have DR and everything. So vast majority of people who are suffering from DR is female, even though some males are also getting affected by DR. Many people don't know that. So please do follow our channel and go through all the videos, especially for DR. We have a complete details how to check and how to take care of it properly, what all conditions, what all exercises, what all other treatments apart from exercises that you can do if your DR is more than 2 centimeter, that you can check. And do like, follow and subscribe to our channel Witness Your Fitness with us.